I want to talk about something that I think has really gone off the rails with the sibo diagnoses, and that is using antibiotics to treat a constipation condition. Now, that is unheard of in conventional medicine. There's only one person who's telling us we should be doing this, and let's think about it. Let's look into that. So let's talk about, first of all, the common causes that are going to cause constipation. And here's a Bristol chart. Number one, two, three, constipation. Common causes: motility issues, hydration, lack of fiber. There's some food enteropathies that can be responsible for for constipation, like the dairy proteins, casein, lactalbumin, and whey. Sugar can do it. Wheat can do it. Traveling can do it. Even if you stay in the same time zone and you eat the exact same thing, you bring it with you, same thing you eat every day, you can still be constipated during travel. I don't have a good answer for that, but if I do, I'll tell you. And then immobility, right? Lack of movement of the body. Okay, now let's take a look at the Bristol chart in terms of diarrhea causes, right? Type 5, type 6, and type 7. You've got colitis. That's any kind of the colitises: eosinophilic, collagenous, lymphocytic. There's so many different ones, but basically they're all diarrhea conditions. Inflammatory bowel disease, diarrhea condition. If you have insufficient fiber, again, that can go either way: diarrhea, constipation. And food enteropathies like lactose and eggs are both very common causes of inflammatory diarrhea. For people that you can do an elimination challenge and figure out for yourself, antibiotics cause diarrhea and caffeine causes diarrhea. Now, did we see infection on the constipation slide? No, we did not, because viral problems, acute viral problems, parasitic infections, and bacterial infections cause diarrhea. So if you want to check my work on this, go to any reputable site. Go to Hippocrates, the Mayo Clinic, the Cleveland Clinic, anywhere that you get reliable scientific information. And please let me know if you find a place that says you can get constipation from a bacterial infection, because there's really only one area where people are claiming this to be the case, not proven, but claiming. So let's just take a look at one of the typical cases that I see on a daily basis. 24-year-old woman, and in this case, I'm preparing a lecture, and this is the sphincter part, the end of the system. So she had her symptoms start in 2024. She had food poisoning. She had orange diarrhea. She started taking Saccharomyces boulardii, which is acceptable treatment. And then her symptoms turned to constipation. She went to her provider and she was tested for SIBO, and she was positive for the methane version of SIBO. She's constipated and she has methane. Methane is a gas production in our bodies in the large intestine. Small intestine, not so much. Large intestine, absolutely. So they gave her antibiotics: rifaximin, metronidazole. She went back for follow-up. She reported that she had no change in symptoms. They repeated the SIBO test. She had the same result, methane dominant. So the decision was to repeat the course of rifaximin. Why? Rifaximin is for diarrhea conditions: IBS-D, Traveler's D. It's not for constipation. In fact, there is 0 antibiotics that are recommended for constipation. 0. Never has been. Again, go to any reputable site. Are we treating the cause? Well, obviously not, because if we were treating the cause, the symptoms would go away and the test would get better. Are we using prevention? Are we using the healing power of nature? Are we first doing no harm? Probably not. And are we treating the whole person? Probably not. So, anyways, she has comorbidities, etc. This story goes on and on. This is just the beginning of her getting an antibiotic treatment for constipation. It never helped. And in my experience, what people tell me, actually, regardless of whether they have a constipation dominant GI symptom or a diarrhea dominant GI symptom, that when they take rifaximin or Xifaxan, teamed up usually with metronidazole, erythromycin, neomycin, then they might have some changes in their symptoms and they might feel slightly better or completely better, and then everything comes back. So the cause has not been treated if everything comes back. And again, I would question your provider for references, and not references that have been established by the drug company that sells the product, actual third party references that say and spell out why you would possibly use a antibiotic to treat constipation, and how could constipation start in the small intestine when the activity, the action of contracting the stool from a liquid form to a solid form all happens in the colon, not in the small intestine.